Devanshu Arora, of course, is going to speak on collaboration for success. So over to you, sir. He is a localite from very much in Dehradun, son of Dr. Arora. So he's going to really give us an idea about this. Thank you.
Thank you so much. Thank you, Dr. Senthil, for this opportunity. I'll be speaking on collaboration for success. Dr. Senthil has mentioned a lot in his talk about collaboration, and collaboration is the way forward for us ophthalmologists as well. So, why collaboration matters for us ophthalmologists? Collaboration in private practice involves working closely with other professionals and industries to achieve mutual benefit. Why it's important. It helps you accelerate growth. We can expand our services, get more referrals. It helps us build reputation, enhance our credibility through partnerships, and improve patient outcomes by coordinated care among different collaborators. So first, let's look at collaborating with other doctors. We need to build a referral network, and the first and most important is to connect with general physicians. Having partnerships with general physicians, especially for diabetic cases and hypertensive cases, it can really improve your practice. So, for example, an ophthalmologist A partnered with 3 local GPs around their practice, and the result was around 25% increase in diabetic retinopathy cases diagnosed in the OPD within 6 months of time. So, the key takeaway here is that even simple partnerships can drive a significant growth in your practice. Second most important is neurologists. So partnering with neurologists for especially neuro-ophthalmology practice or neuro-ophthalmology patients, even your general ophthalmology practice can help you a lot. If you have a visual field analyzer equipment, then the proper utilization of that can also be done, because many of the times not be utilized for all glaucoma cases and other cases. But if you're getting referrals for field analysis from other physicians and neurologists, it can help you utilize that equipment better as well. Then is collaborating with other hospitals. So the corporate hospitals are there everywhere now, and especially in the beginning of your practice, you can serve as a visiting consultant to increase exposure and credibility of your own yourself. And if you don't have a OT at the beginning, if you are starting small, you can even reduce your cost by using their surgery setup and equipment at the beginning. And for more mature and more advanced centers, there are options to tie up and run the ophthalmology department of the corporate hospitals, because for the corporate hospitals, usually ophthalmology department is not their core focus. And many of the corporate hospitals are actually willing to outsource their entire ophthalmology department to an institute. So if you have that kind of a capability, you can tie up with them, and this will help you even utilize your own staff better. You can rotate them to your center as well as the corporate hospital. There are a lot of small private hospitals who are not able to provide complete eye care services, and you can partner with them, serve as a visiting consultant. And since they might not have a phaco machine or like a IoT setup, so you can have those patients coming to your center, and you can perform the surgeries and continue the care with them. So it's a win-win for both the small hospital as well as your own practice. Then the second option is to collaborate with NGOs. A lot of us are doing that. We can conduct eye health camps in partnership with NGOs, and this will help, that way help can do camps and serve underserved communities. This will also help you build your clinic's reputation in the long term. So most important, the one which I like the most is the corporate collaboration. So very less of us are exploring this opportunity, but there is huge potential here. So collaborating with corporate organizations is one good option. A lot of small corporate companies around your practice may be having corporate wellness programs. Their HRs departments are running corporate wellness programs, and they will be willing to partner with you for eye care services. And you can offer vision care and eye care checkup camps for their employees. So this is one of the most rewarding form of outreach, because it's a win-win for the organization as well as your practice. They get to have that eye care screening for their patients and eye care services for their team members, for their employees, and you get word of mouth for your practice. Not only those employees will come to your clinic, but they may refer to their other colleagues and friends who will get to know about your hospital, your clinic, and this will help you build both business and goodwill. Using technology to expand collaborations is also one of key points in today's age. There are a lot of options. So one example is telemedicine in ophthalmology. We just had a talk, an entire session on it actually before this session. And you can collaborate with a telemedicine service provider. There are a lot of, you need not build that capacity yourself. There are startups and organizations which are actually providing telemedicine services, and you can utilize their, you can have a partnership with them and offer remote eye care consultations to rural patients in your state and your region. And you can expand your geographic reach without needing to invest a lot or open additional physical locations. And need not say government empanelments are a must for any private practice in today's age or in a hospital. And the most common ones, CGHS, SGHS, state government health services, and ECHS, we all know. But also try, if there is not an ESI hospital nearby, try to have an ESI employee state insurance empanelment, which where you can get referrals from ESI dispensaries in your area. And Airport Authority of India is one more option, which we sometimes don't explore. And other options are state power corporation, state police forces, and other state and central government institutes which are there in your region. You can explore and get empaneled and increase footfall in your practice. So these government empanelments are not just to get the patients who are empaneled and treat them at a little subsidized rate. That will help you in a certain way. But those patients who come to your center via this route may actually refer other patients who are paying patients, or out of pocket paying patients, and that will help you generate more growth in your practice. So there are challenges in collaboration we all face. One is managing expectations. We need to ensure clarity on patient referrals and revenue sharing whenever you are collaborating with any corporate or any organization, and have a standard for service standards, especially when tying with smaller hospitals. And then there is legal and financial aspects. Secure proper contracts whenever you are going for a complete partnership. Have agreements before starting any collaboration to avoid disputes in the long term. And communication is the key. Establish regular communication with collaborators to keep all patients aligned, all parties aligned, I mean. Overcoming these collaborative challenges for managing expectations, clearly define the roles, responsibilities, and revenue sharing structures upfront. Don't wait for this discussion to happen at a later date when you have already started. But be very clear in the beginning itself and keep clarity in the roles which both the parties may have. Create detailed agreements to safeguard interests and discuss profit sharing models transparently. Effective communication, as I said, is the most important. Hold regular meetings and see where things are progressing and take it forward from there. So the key takeaways in this short talk I would share are: collaboration broadens reach and expands patient services and helps you enhance your practice, grow your practice. Collaboration with doctors, hospitals, NGOs, and more importantly, corporate organization offers multiple avenues for growth for our practices, for our hospitals. And using technology will help you expand geographically, offer value-add services, and overcome these challenges through clear communication, signed agreements, and aligned expectations. So are you ready for collaboration? Take the first step once you go back after this conference. Identify one potential partner, a doctor or hospital or an NGO or company, and explore how you can start collaborating. Look at your practice and assess where partnerships can enhance services and broaden your patient base, help you expand your services. And collaboration is a win-win. Start small, scale up collaborations as your practice grows, and follow this going ahead. Thank you.
Very short and sweet talk. Very important go-home messages for all the individual practitioners, especially in the rural area and even in the mega cities. You are sitting on the top floor of one of the buildings. How does the patient see there are no boards in and around? This is how we should go about. So very nicely covered each and every point. Any questions to Dr. Senthil or others, please ask. We have about only 5 minutes left before we wind up the session. So I was just, Dr. Arora, with the build-up of, say, in a tier 2 city, if a person wants to start the practice, what are the minimum equipments he should have? Tier 2 and a rural setup. Mega, to of course, we have to have a full setup. Definitely. To have doing very well in this.
So it all depends on two factors. One is how much financial investment are you ready to invest in the initial beginning? Do you have a capital fund? Do you have a capital fund already with you, or have you already secured bank financing, or what kind of investment you can make? And second is the kind of market that is there in the region which you want to start. So are there already a lot of providers? Are there already corporate hospitals in your area, or are there bigger eye hospitals around or not? But still, I would say that starting your own practice is quite possible, even at any scale you want. There's still the ophthalmology business, as we are saying that there is a lot of competition, everything, but there is a lot of demand still. Still there is underserved. You can identify those areas and start there. Having equipments, I think it depends on your specialty, but if you are starting a general ophthalmology setup, the basic is the entire OPD flow should definitely be there. And you may not initially have the cataract OT or the eye OT. You can begin with partnership with a smaller hospital nearby, utilize their services, and just have your first like screening, refraction equipments, and your team around that, and slit lamp, and complete your examination OPD setup.
Absolutely. See, there are various options which I think is very important, especially for a beginner with less of funds. As Dr. Senthil has said, you scale up slowly. So you have the skills, but you don't have the money. How do you go about it? A few general tips which I would like to share is, one is, you have a rental place, don't invest in the place initially. And you make a move around in the periphery about 30 kilometers around to, that's like an outreach program. Initially you need to do, telemedicine is of course one part of it, but unless you show your presence and your skills in the mini setup in and around about 30-40 kilometers out of your area of practice, you are not going to immediately catch up all the people on day one don't enter. That is one thing. So don't invest on the the clinic infrastructure. Buy on the equipment, the basic equipment that you require is a very good slit lamp. Don't compromise on the things which are going to help you have proper diagnosis. So all your equipment should be the best grade. I won't say maximum price or the costliest, but it should be good enough in what is happening in your area at least. That is what I would say. What is said is, regarding microscopes and else, you need not invest in the initial phase. Base OPD equipment, and lot of, at least I am practicing in Pune, all the other equipments, the major equipments you require are available on rentals. Something is, somewhere it is 500, somewhere it is 1000. So that you can cover it from the patient and still not compromise on the diagnostic facilities. You have the YAG laser, we have the OCT which is available, we have the optical biometer which is available on rent. So without compromising also, you can still do the practice in a top way. So that is the second tip which I would like to give. Third is, whenever you are buying a loan, try and get only the government, that is nationalized banks. So they have offer the minimum percentage of loans. A the government or a private institute is almost 1 to 1.5. So on a lakh you are paying 1,500. For an early practitioner it's quite a bit. So I would say go in for a loans where, and they try and give you maximum number of, the percentage is 80-20 or 90-10, where 10 is your percentage, that is your amount that you have to put in to get that amount of loan. So priority should be mainly on the instrumentation, diagnostics, and the primary OPD. OT and this you can utilize close by hospitals, you can collaborate with one of them, they utilize their services. Of course you are going to earn a little less, but more of peace of mind, and you have enough time to scale yourself. Do you agree, Dr. Senthil? Yeah, he has got a different view. So this is my